Hi all. In today class, I'm going to discuss about medical device that is a Holter monitor, right? So before getting into this main topic, we should know why such Holter monitor is very much needed instead of having other monitors like cardiac monitors and patient monitors, and what is the main difference among these three, and when the Holter monitor can be used, and what are the application, how far it can be supported for the patient. So everything is much needed before getting into the main topic, right? So let us start with introduction, that is what is being the Holter monitor. The Holter monitor is a very small wearable device which is meant to track our heart rhythm continuously, that is for 24 cross 7. Okay, so it is mainly meant for long term monitoring device. Okay, so this Holter monitor usually come up with electrodes on the battery operated device. It is a small compact device, so it is can be easily carried by one person without disturbing their daily activities and daily routines. So they can easily monitor their heart rate with by means of electrodes which is placed over skin, chest, and then the data can be stored in the storage. We can also have analyzers at the later cases. Okay, so the main thing of this Holter monitor, it's provide continuous monitoring, that is 24 cross 7, without disturbing the patient or people their daily routines or daily activities of their life. Okay, this is the main thing of a Holter monitor. So this Holter monitor can also be called as ambulatory electrocardiograph. You know what is meant by electrocardiograph? That is nothing but ECG. So what are the function which we have in case of ECG? The same function we have in Holter monitor also. The same here, we have the electrodes, set of electrodes we have to place over the part of the targeted area where we want to sense the heart rhythm activity of the heart, and then we have a monitor also to display the ECG signal. The thing here is the Holter monitor we can have continuous recording, whereas in ECG we will have event records. Whenever the problem arises, at the time we will go for ECG, we will measure and check our heart rate. But in case of Holter monitor, we will keep on track our heart rate monitor for 1 to 2 days, so that we can easily identify where the problem lies and what are the condition in which the problems are lies. So these kind of analysis we can do with Holter monitor. So when this Holter monitor can be used in the sense, so there are some cases the people with unexpected heart problem will have. Okay, in such case, ECG may not have detailed information. So in that case, the doctors will suggest to go for Holter monitor to continuous recording our heart rate for example 24 cross 7. Okay, so in that case, if you are monitoring our heart rate, without disturbing our daily activities, people also will not feel any discomfort, since it is a very small packet size device. So they will carry out their activities, in which activities may cause a discomfort to the heart will also be reflected in that monitor, that is a recording of heart rate. Okay, so in this way the doctors will also come to know in which activity and which condition the heart may feel discomfort, so that their activities changes, and what kind of recommendation or treatment we can give on, and everything they will do with the help of Holter monitor output. Okay, so this is what main overview of Holter monitor. So let's see the application. As I told you before, the Holter monitor we can use when the people will have unexpected problems. Okay, that is asymptomatic problems or asymptomatic disease, heart related disease. Okay, so even not only asymptomatic, even symptomatic even also we can identify. So here I have listed out a few of those. First, if you start evaluation of symptomatic events. Okay, So you know what is fever symptoms, right? So some in some case the people may feel dizziness or heart palpitation will be there, or chest pain without any reason, without any without any symptoms. The patient may feel the chest pain or shortness of breath. So it's and we have these type of symptoms. They somehow it may be related to the heart problems. So in such case, the doctor will advise to go for Holter monitor, and also used to detect the asymptomatic dysrhythmia. So dysrhythmia is nothing but it's a abnormal heartbeat. So there are some heart rhythms I mean heart abnormality which produce without any symptoms. Okay, so this has to be take care immediately. The required treatment should be given at the early stage, or else it may end up with some pathetic situation. Okay, so that so it is a help to detect the asymptomatic dysrhythmia. And next we will have like ECG. We will here also we have we can easily evaluate our heart rate, their rhythm, and ECG interval changes during drug therapy. So there are certain drugs when we are giving, it may reflect our or it will have the impact on our ECG signal. So by using this Holter monitor, even we can monitor or record or analyze the such changes happen in the ECG when we have continuous monitoring. At last, we will have evaluation of post myocardial infarction and post coronary bypass surgery. Okay, so that is after doing surgery, we will have the patient under observation to check any side effects or any discomfort they feel after surgery. So in that case, this photomonitor will also be recommended to monitor the heart rate activity, whether everything is okay or everything is fine with the patient before they get discharged. So these are the few applications where the Holter monitor plays a very important role in order to give the proper treatment. Okay, so next we will see how does the Holter monitor work. Okay, so far we discussed what is Holter monitor and their application. How does it work? So it is very simple. It is almost similar like our normal ECG. It is a very small and package size device, and it is usually come with so many leads, and at the one end of the lead is connected to the monitor, that is the heart of the device, and the another one is hardware of the device, and the another end of the leads is being connected with the electrodes, and the electrodes we will place over the chest pad where we want to tap the signal. Okay, record the activity of the heart. Okay, so this is almost similar like normal ECG machine. Okay, then where it is being recorded, it also is other important things which we have to come into consider. Okay,